welcome everybody. My name is Jennie Robbins. I'm the Senior Director of at Church Health. I run finance and performance and also advancement and stewardship. So thanks for joining the first of this budget call for Church Health and Echo, just to sort of do a 2.0 of the replication, focusing a little bit more on the financial pieces of the organizations, whether you're a startup having 2 days of operation or maybe a couple of years and you're starting to expand. So welcome everybody. We've got an hour and we can take up the whole hour or not, but I do want to go through a couple of things. We're going to do an introduction of who I am, and then we're going to talk about the budgeting, sort of the process, capital versus operations, building a team of support around you, some Q&A around budget if there are any, and then just sort of some mistakes, trial and error, and what you wish, some of the things if I had to do over what I could do better. There is a chat window available, and Josh is going to be recording our questions and some other comments and things if you want to type something so we can have a detailed account of what we've gone through or other things that we need to follow up on. Just let me know. And of course, appreciate feedback after this session is over. This is the first one that we're doing. We've got 2 more scheduled. So thank you all for being the first guinea pigs of this session. So again, I'm Jennie Robbins. I've been with Church Health now almost 11 years, and I'm from New Orleans originally. I talk fast and I've got the Southern accent, so forgive me if you don't understand the New Orleans, Memphis, Tennessee blend. I'll slow down when you need me to and speed up if this is all starting to get a little dry and boring, so just let me know what works. I started with Church Health Center after about 8 or so years in the banking world. Did everything from, started out in the branches and then worked up to commercial lending. And, loved it, really enjoyed it, but wanted to take a step back, start a family with my husband, who I've been married to, almost 16 years now. And really sort of wanted to take a step back and get into the not-for-profit world where you focus more on the people that you're serving rather than shareholders and stock prices and things. So I joined Church Health as the Memphis Plan Assistant Director, which is one of the revenue generating arms of the organization, so for some additional cash flow. And, volunteered, promoted to other positions within the organization. And I think I have now plateaued as the Senior Director of Finance and Performance, and also Advancement and Stewardship. So day to day, what reports to me is if it does not touch a patient or someone that we serve in the community, it reports up to me. So from finance to IT, data analytics, various technology processes, other reporting, development and communication, all of that comes my way. So, I love it. It is a different task. It is a different challenge every day. But for the most part, my day-to-day responsibilities include everything general and administrative, and checking emails, reading reports, looking at numbers, and talking to people, from folks in the organization to donors to vendors to board members, just to make sure that I don't lose control or sight of what's happening within the organization, because a report can tell you so much, but it's the conversations and asking the follow-up questions that really help get to the answers to make sure that your organization is healthy. Again, this happens whether you're a startup or expanding from 1 day a week to 2 days a week, or you've been in operation for 2 years and you just want to have a checks and balances. So it is the same either way. So one of the philosophies that I'm working on within our finance team and our senior leadership team when it comes to our budgeting and spending process is what I refer to as earn, budget, spend. So you earn it, and you pick what time period works for you, whether it is a quarter for a startup or an annual budget, if you've been doing this for a little while. You earn it one year, you figure out for the next year how you're going to budget it, and then you spend it in the third year. It is a lofty goal and a lofty challenge, but it starts with knowing your day-to-day pieces of how much money do I spend in a day, or how much money do I spend in a week, but really always knowing how much money you're going to spend.
我听不到你们有没有办法？
Hi, Helen. It's Jennie Robbins with Church Health. How are you? So welcome to the call. So, but the earn, budget, spend is really important to make sure that you're monitoring the cash that's coming in and matching it with the expenses that are going out, and making sure that you have got actually a good process and chart of accounts and things to make your organization work. And then also understanding the difference between the capital gifts or the capital needs and expenses, as well as the operating expenses. So capital are your higher ticket items. Church Health looks at capital expenses of anything that is tangible that's over $5,000 in a 12-month period, from software purchases for long-term use to furniture, fixtures, other equipment, and things like that. And then operating are your day-to-day needs, payroll, supplies, taxes, donor events, medical supply needs, etc. Knowing how much your operating costs are on a monthly basis is so important to making sure that you will not run out of cash before you run out of the month. And then building a team around you. I know we're all not-for-profits and faith-driven, and so we have board members who have their own time and talents and also contributions to bring to our organization to help us grow our missions, to serve more people or to serve them better or to introduce new programs. So really having a team around you for your board is critical. Knowing who your advocates are on your committees, communicating with folks who are your donors or other contributors or constituents is key. There's sort of the adage of those who help write will underwrite. So if you've got board members and vendors engaged in your day-to-day process. Okay, sorry, Helen. I know you can't hear. Josh, we're recording this too, correct? Okay. And looks like you've got some folks helping you work on the sound. So sorry about that. But again, if you can find advocates to have open communication with on a regular basis that are board members and folks that are outside of your day-to-day staff, that is also a critical help when it comes to not only fundraising, but sources of revenue, where the money's coming from, how you're spending it, and things like that. So our budget process, we're a large organization, so we have got a pretty robust budgeting process with workbooks. But for organizations that are less than $5 million, QuickBooks is your friend. An Excel spreadsheet is not a database, and a formula can change. A formula error can have a huge spiral effect going down that can sometimes cause larger issues. So I encourage everybody to use an outside resource like QuickBooks. Most of them will all connect to banking systems with whoever your financial institution is. And then plus it makes the reporting process easy. It is a button click. So for those of you that have not gotten your financial processes and pieces set up, I encourage you to look into QuickBooks or something similar to that. It's really easy. So I guess let's open it up for some questions. I've covered 3-4 points pretty quickly, and just kind of want to get a feel of those who have questions or experiences or other conversations about revenue sources. So y'all can type in the chat box or take your mics off of mute and ask the question. But obviously, donations from our donors are key to helping us sustain operations. It's just like in the for-profit world, you don't want to rely too heavily on one particular funding source or one particular donor, because what happens when that donor gets unhappy or doesn't like the direction of the organization or a choice that was made, or in grant particulars, if you have got a grant that's maybe a 3-year grant and you're starting a new program which requires staff and other funding, what do you do when the grant runs out? So if you can create revenue sources from a sliding scale that you're charging your patients, donor gifts, cultivation of donors at all levels, recurring gifts are key. Especially when you're fundraising, it's great to have a donor who's going to write you a $20,000 check this year. But what happens next year? So when you're making your donor calls, showing them what your budgets are and showing some projections to have a 3 to 5 year outlook. And again, QuickBooks will do this for you, but to have a 3 to 5 year outlook on where your projections are in spending can also help a donor see that this year a one-time gift is not enough. So always asking for that multi-year pledge is great. And then at all levels, what's a recurring giving source that you can have, whether it's anywhere from an I Give campaign of $25 a month, upwards of a day of giving, $2,500 a year to $20,000 a year, and what are the potential sources for that? Private foundations, individual donors, other faith communities, having your patients become the grateful patient advocate. So any funding source that you can bring in is great. Any suggestions for banks that are friendly? I'm sorry, the message popped off. Any suggestions for banks that are friendly to what? Okay. All banks have got Community Reinvestment Act money that they need to put into not-for-profits in their communities. So I would start with a bank's website to look to see who has those programs. Bank of America has one, but most banks, and in particular the national banks, SunTrust, Bank of America, Merrill Lynch, Regions, they have got matching programs too. So if you have donors who are giving you funds and you know that they work for a bank, to ask them to put in for a matching gift, or to then reach out to the bank's foundation to see if they will match the matching gift is a great opportunity as well. Again, it's the diversification of funding sources. So Josh? Okay. So Church Health just went through a major capital project, and we've moved into we've consolidated 12 buildings in a relatively, mile radius space, consolidated 12 old buildings into one space for 150,000 square feet. And the magic was, we really sort of said, what's the max potential that we think we can raise? How much space are we going to have? And so we cannot have a construction cost come in at more than X amount of dollars per square feet. or per square foot. So it's working with your partners and sort of understanding what your donor pool might be able to do, and really working with good contractors and architects to help you design. So everybody's, it's just like the budget at home. Of course, we all want these particular countertops and we want these particular appliances, but how does that match with what you need and what you can afford? So the blend between all, and then also not shortchanging yourself with, well, we're going to cut corners here and then we might build this out later. So a lot of the planning piece, and winging a prayer. Ann Langston did the biggest heavy lifting pieces with our own process on the contract and construction pieces, but we worked really hard to say, okay, our area could probably support no more than $120 per square foot. So anytime we would look at kitchen equipment to provider beds to the paint on the wall to the type of flooring, it was, are we staying within this budget? So really knowing what you think you can afford on the max. And I would say, on over a 3-year period, look at your cost over a 3-year for facilities and how much do you think you can pay every year, and then cash flow. And do you have a bank that could potentially help support either the loan to get the process going or to help with the repayment options? We tried very hard not to use any traditional financing for this. So we did everything through cash operations, and we had at least 50% committed before we even started the construction. And then timing with when the pledges were coming in. So we really were able to do this with minimal outside credit because we had most of it already committed before we started. But, really getting your board involved to figure out what you think you can afford and where some corners you could look at instead of buying provider beds or exam tables. Can you get them donated? And then using those resources of if you had to pay for it, here's how much it would cost. But then where can you go find sources that can help you get donors to put this in? But it's really goes back to how much space do you have and how much funding can you dedicate per each square foot. Is that helpful? Mm-hmm. Okay, so this is my old banking life, and not-for-profits really can be debt averse. They don't want to have anything outstanding on their books, but because we are really dependent on the grant dollars and the donor sources, and our patient income is very low, we don't want to have to close our doors because we're 2 to 3 weeks short on a project or something. So I think it's always a good idea to try to establish a credit line for operating needs. Try to do, 1 to 2 months of operating needs on a credit line when you don't need it. So find your banker and establish a relationship with them and just get a 12-month credit line that you only pay for if you use, but get it established before you need it. Because if something happens with your financial picture or your donor picture, and you decide you finally do convince your board to let you establish a credit line, sometimes it can be too late. So while things are going very well and cash is good, patient visits are up, donor calls are coming in, and the checks are coming in, that's when you go establish a credit line. And you generally would say 2 to 3 months of how much it costs you to operate just your operation costs, 2 to 3 months of those is probably what you should target your credit line request for. And that's on the operating side. Now, on the capital side, that's a little bit different. What is your total budget? How much have you already had committed in pledges? And then I would do another fourth to a half of that. So if your project is a $500,000 facilities build out for improvements, just tenant improvements, and you've got $250,000 committed, and it's going to take 3 years for payouts or for the project to be completed, to maybe request from the bank, $200,000 to $250,000 might be a good place to start on the capital side. You always want to ask for interest only. That way you're not having to make principal payments when cash is tight or when pledges don't come in. Lower the rate, the better, but interest only, and as few dollars in closing costs as possible. So, but I am a huge advocate for getting credit before you need it, because when you do, the last thing you want to think about is, what banker am I going to talk to? So get it while you can. Other questions? Okay, well, thank you for the compliment. Budget season is always one of those where I develop new gray hairs, and it's not just about getting older, but we talk about building a team around you and then always having constant conversation with those managers. I have the benefit of also having fundraising report up to me. So I'm always talking to our various programs about what they've got coming down the pipe too. So I kind of have already an idea of what our programs are working on and what the day-to-day pieces are. But I can't, from my position and my finance director's position, we can't always know the nuances of the day-to-day pieces of how to actually execute what it is that we're trying to accomplish within our mission, whether it's, we need to buy these medical supplies. They don't want me ordering the medical supplies. I can hardly spell Henry Schein, much less order and know I'm getting it right. So you do have to trust the managers in the role to understand what the mission is and to understand that cash is always a key thing. So, we talk about the monthly reports. Everybody's looking at their monthly reports over and over again. And I'm always asking questions if there's a timing issue, what things are new coming down the pike, if they haven't spent the money yet, do they think they're going to, just so I can continue to learn, and they know, and the managers know that people are actually looking at how we're spending the money and how we're coding. Talked about QuickBooks with a chart of accounts, giving the managers parameters and understanding of, okay, this year we're going to focus on growth in this clinical area and this programmatic area. So the other programs, we have to have a budget hold, or anyone, we're only going to have a 2% operational expense increase because we're going to shift more to our staffing increases. So it's giving people parameters, having constant conversations, and the two-way open dialogue. When I ask a question about a budget anomaly or a budget variance, and someone else is going to tell me about, well, they dropped this one class this month, so they didn't have the revenue coming in, but we're going to pick up 2 classes the next month. So again, going back to the communication piece, helps build the trust, but then also giving the managers the parameters I don't need them to understand about inventory and days on hand and pieces like that. But so I trust them to do their day-to-day job, and they trust me to make sure that we're going to have cash in the bank and we're going to be able to cash flow and I'm going to be able to make payroll. So it really is that balance and accountability act back and forth. Hi, Adriana. The balance and accountability piece that we're trying to make sure everybody's got working together. Okay, so I inherited a budget that I need adjustment. So the better your report looks, the more well thought out it will appear to your board. I would suggest, if you don't have a finance committee established, making sure that you do have an established finance committee so you are not the only person. Going back to the advocate piece on your board that's outside of staff. Okay, you don't have one yet. Get one. So, or find somebody on your board that can identify with the financial piece and express, where you're wanting to make adjustments. So you need to have internal advocates that are on staff, but then the external advocates are also great too. And they need to be able to see your confidence in why you need to make changes or why you need to make adjustments or where your concerns are. So you're also, if folks who are in the financial piece are also the risk mitigation, and we try to make sure that we are able to control the risk and identify it, but not be Chicken Little. For example, our board chair, this is his second year in the board as a board chair, but he's been on our board for a while. He chuckles because now it's budget season, open enrollment, and he will make comments like, I appreciate seeing you and Scott, or Dr. Morris, who's our CEO, sort of spar back and forth in a board meeting of, where the vision and the mission is versus what the realities are with our budget. And, sometimes if I'm having a down day, I do go back to Rob Carter's comment of, Jennie, if Scott's not mad at you during budget season, something's wrong. So it's just how confident are you to make sure that your advocates help you work through this, and you are able to, mitigate the risks while not sounding like a naysayer or always no. I mean, a lot of times the person in the financial position, we get labeled with, they're just about the numbers, they're just about the money, they don't understand the mission, they don't see the vision, they don't get it. And, it is really hard. And to go back to find a comment that helped get you over the hump or make you not feel so, Eeyore, if you will, or Chicken Little, if you will, really does help move you through it. And then just reiterating to folks that you do understand the mission, but the reality is we can't execute the mission if we don't have the funds available, if we don't have the volunteers in place, and we don't have some processes. And the processes and procedures and guidelines from, spending to managing the reports and still giving people enough leeway to learn and make mistakes, it is a constant struggle. And sometimes it really looks like we've got it put together and it's all well planned out, but it is, a lot of times it really is just a wing and a prayer. And how much do I think we can increase, or how much do I think we can raise more per year? Don't tell anybody, guys, but a lot of times I just make it up and go from there and then see if I can back into the numbers. So come up with your number, back into the situation, and does it mesh? And if your board approves, then, and you've got some advocates, then you're doing the right thing. The grant piece is the scariest piece. I'm going to take that one first because that is one that gives me the most heartburn. Because if you get a grant that's a 3-year grant that's about a program delivery, you may have to hire staff, buy equipment, or a software or what have you. And after 3 years, they don't fund the grant, or you lose the grant funding, or you don't hit the milestones within the grant markers, and then you don't have the money. And the last thing anybody wants to do is have to fire a staff person or fire somebody who's doing good work. It's just timing. So the credit line comes in very, very handy with those pieces, especially on the grant side for operations. But then, understanding the need for diversification in revenue from fundraising. The grant funding is the hardest piece, and we try really hard not to apply for a grant that's either not complementary of something we're already doing or that's going to help us do it to reach more people. We try really hard not to have a grant that is requiring us to go hire new staff that we can't then support on our own after a 3-year process. And looking at and most grants are 3-year grants. So say, for example, you've got a 3-year grant, and after the first year, you're not hitting the markers or you're hitting it out of the park. That's when you got to start looking for your outside funder, or you start talking to the grant maker about what's next. So you've always got to think about the what's next. What was the other part of your question? The cash flow piece. Well, we are fortunate to, again, being in a faith-based organizations, we do get those surprise gifts, and some of that can go into the earn, budget, spend piece of it. We have got an operating checking account that we keep for everyday use. And then we also have a separate account where I will stash some of those, we didn't think they were coming, or we weren't sure it was coming, or this is, a windfall that we'll put into an operating investment account that we might use within 12 months, but really sort of look at it for an 18-month projection. And then within our financial policies, we also look at endowment gifts, unexpected endowment gifts, unexpected bequests. So legacy gifts, people who have left money to us in their will, we will put that into endowment, and really sort of sock that away as a idea to not use it or to not have to rely on that for operating needs. But sometimes, you're white knuckling at the end of the month, or right before a pay period, or right before you have to go pay out your benefits, and where is the cash coming in? So because of not-for-profit, we do have to do accrual accounting. So you've got if you get a 3-year pledge, you book 100% of the 3-year pledge when you get it, and then always looking at your cash flow projections, so you'll know what funding is coming in. So you have the luxury to be able to look at what an unexpected contribution, where it's going to do the best good. Do you need to put it in operating because you're a little short on cash flow? Can you put it in a sock away operating investment account that you might not use for 12 to 18 months? Or are you really in a great position and you want to put it into an endowment account that you can leave for sustainability of the organization? So it's sort of, you look at it 3 different ways. And again, QuickBooks is great at helping you space out the pledge payments on accrual accounting. And also, if you've got someone who is going to be a recurring donor, either monthly, annually, quarterly, helps you sort of know and realize where your cash flow is coming from. Yeah. So that's go to your consultants, go to your advisors, talk to your board and say, say, for example, you get a $45,000 check and you need to buy this piece of equipment that's going to allow you to serve more. If you've got the cash in the bank for 6 months, buy the equipment, fill it out. But if you're worried about, if for startup clinics, if you don't have 6 months sort of in reserve, I would use part of that gift for the 6 months, part of that gift for buying what you need or socking it away for later. But I wouldn't put it all into your operating account, because if it's there, you might spend it. So, maybe half of it going into capital, half of it going into operations. But, for startups, if you've got 6 months in the bank, that will help you sleep at night and be able to help your staff and your volunteers and your coordinators serve those who are in best need. So hang on, we haven't talked about prioritization, but so always making sure that, again, within your board, that the board has a priority list, whether it's a capital list or an operating list. On the capital side, it could be to buy these new pieces of equipment, upgrade the software or a phone system, or purchase a building. Or is it on the operating side, going from 2 to 3 days a week or 3 to 5 days a week? And then seeing which is easier to find donors for. So one, having your board help you create your priority list, sticking to that, and then having a living document, almost like a strategic plan of priorities, if you will. So when unexpected contributions do come in, you already know how you're going to spend it, and you don't have to go back through it would be a good idea if we could do this, or wouldn't it be cool if? Well, you've already sort of got it planned and processed out, so you're not the bad guy when you say, actually, no, we're not going to go make this hire, or no, we're not going to do this because we haven't done these things yet that the board has agreed to. Having a board backing can really be your best friend when it comes to a situation of your mission visionary person saying, I really want to do this. I think we should do this. It feels good to do this. And it absolutely does. And we would love to do it if I had this money every day coming in. However, I do have to make sure we're planning for the rainy day, and the board has outlined these particular priority items that we need to get through first before we do something else. So it's just the accountability check, and that is where the board can be the most help on the financial perspective, helping you be accountable to the board, your CEO being accountable to the board, and everybody understanding that you are looking for the risks, you are looking for ways to manage a process through it. But then it also, again, if your board can help you write your priorities, your board can help you find donors to fund them. And coming up with donor designated funding opportunities, especially for the startup clinics, and those looking to grow, those named opportunities or those specific outreach programmatic opportunities are your best ways to find new donors, to find out where your donors are engaged and where they want to support. And that can help also drive some of your priorities too. Okay. So for a named opportunity, this is about knowing your community and what the community needs and wants, what the desires are. But we have got, on an operating basis, we call our Gift of a Day program, where anywhere from an annual gift of $2,500 to $25,000, you get to name a day in honor of somebody. And it's I hate the word pyramid or network marketing because it's sort of where everything is on Facebook. But if I have a donor who is going to give me $2,500 to go towards general operating in honor of his in-laws anniversary. Now I've got the donor who's giving me the money, and then I've also got the person who the donor wants to recognize, and that donor, and the person who the donor wants to recognize might not know about my operation. So I get to thank the donor, and then I also get an opportunity to introduce to a new potential donor who we are. They learn that this donor, that donor A is engaged and loves what we're doing. And it's almost like an invitation to engage donor B to have them want to come and learn about us too. And that's on the operating side. And then we also look for, for example, if we know we are going to spend $30,000 a year on vaccines for either childhood things or flu or what have you, we may have a government funding source or something else that's going to help us fund that. And of course, patient fees are going to help fund that. But we might go to a bank and ask them for a $30,000 annual gift so that they could help us vaccinate the community. And and it would be on any publication of any newsletter or donor letter or what have you of our annual vaccine program is donated generously by Bank of America or by the employees of Bank of America. And it's that sort of naming opportunity for what you need. Or our medical supplies have been brought to you by, it's the Sesame Street adage. It's, can they have something tangible, even though you may have a government funding source or another funding source that's going to help you do this through patient fees. And then on the capital side, understanding if you're building out rooms, either exam rooms or pods or administrative areas, some donors really like having their name etched in something. And so offering them, if they're going to give you $500,000 to build out your clinic, well, then it becomes the donor A from Texas Clinical Services Center or clinical services line. So naming opportunities are great, either with plaques on the wall, recognition in a newsletter. That people like the pats on the back. And for those of you all who have gone to replication, have heard everybody wants a pat on the back: the donor, the doctor, the volunteer, even your dog. So finding out how a donor wants to be recognized and continuing to cater to that is key in order to get annual operating support or large one-time gifts, and then hopefully a legacy gift after the fact. Every single way you can. Of course, you always want to recognize the gift as quickly as possible, whether it's, we try to have a 48-hour turnaround with a thank you letter that's generated from our fundraising system that Dr. Morris signs every single one of them, and then we'll review them, and I might put a note just depending on who the donor is and what the gift is. We also have a unwritten guideline. Any large check above $5,000 that comes in, Dr. Morris picks up the phone, my development director might pick up the phone, or I will pick up the phone and call them. And then putting things in our quarterly newsletter with who has given money throughout the day, throughout that time period. So every way possible. Again, for tax reasons, you've got to send the tax acknowledgement letter. But thanking them publicly, privately, over and over and over again, letting them know how grateful you are, giving them patient stories, helps continue to keep the engagement. And you don't just want to thank them once, especially if you're looking to cultivate that donor as an annual donor. You want to make sure that you're talking to them when they're not giving the money also. So just, if you know that they're interested in cases about children or something, and you've got a patient story that might interest them, to drop them a handwritten note, thought about you, so-and-so saw a patient today, they came in, they were sad, we helped them through the situation, and now we've got them on the path to see a specialist, or we've got them enrolled in a child services program, what have you. So any way you can find an opportunity to touch a donor multiple times with a thank you is key, and it pays off in ways that a lot of times you don't know. And then publishing names in annual reports or newsletters. The honorariums are also huge. When we have got folks who have made gifts in memory of somebody, we publish that, because, and it's not donor shaming, but a lot of times if we see that Janie gave a gift in Cindy's honor and Cindy's BFF Ellie didn't do it, well, maybe Ellie will start doing it too. Or if so-and-so's father passed away and you didn't realize that it had happened, but memorials came to your organization, you realize, oh gosh, I missed that, and you'll write a check too. So it's you never know the power of a thank you, or the power of an acknowledgement or a recognition, and the exponential network marketing it has. So you can't thank donors enough, and there is not a best way. You just have to do it always and often and every day. You're always on. As a fundraiser, as a gift officer, as a financial officer, you're always on. And then on to the second piece, Josh, about the tough news to the board. I get really red when I have to deliver bad news. So I always make sure I've got a high collar or a neckline or a turtleneck when I do have the board meetings, because they will ask you the tough questions. So always be truthful, don't sugarcoat it. For example, yes, we had a not great development month. We've missed our mark. We are $200,000 behind for the year. However, we've got, and then what's your mitigator? We've got 6 grant applications out that we should hear something back in within the next quarter or 2 quarters. Talk about yes, we're having a bad financial quarter. However, we're going to not make a contribution to the 401k this year, or we're going to increase the employees' portion of the benefits for open enrollment. You state the problem, and then what are some of the 2 to 3 pieces of mitigators, or here's how I've thought through the situation. But then going back to the advocates and allies on the board, if I've got bad news to deliver, I want to make sure most of them hear it from me before the meeting. The meeting before the meeting, for both when you're trying to push something through the board or get them to vote on something, or you want someone on your board to hear something differently, to have an advocate, and it's not necessarily a plant in the room, but to have somebody be in the know with you that can help either say, look, we've talked about this, it's a problem, they're aware, and we're monitoring it, or look, she's worried this is an issue, and we've got 2 or 3 ways that we think we can get around this. But then also a lot of times it can be a call to the action for the board of, we're behind a little bit. And many times they'll just write, they might pull out their checkbooks and write a check there, or say, okay, well, who are your grant funders that you've got applications out to? I'll make a call. So, again, not everything is always rosy. You can't always be Pollyanna, but you're there to have the tough conversations and to be the risk mitigator as well, because you can't always be good news if your financials also don't reflect that. But you never want to walk into a room cold either, if you can help it. So we got about 8 more minutes. What else? Okay. safety net money. Are you all familiar within your own states about the uninsured funding that a lot of states have? I know Tennessee has got a pretty robust safety net program. Texas has got a pretty robust safety net program. That's always a great start. If you don't have safety net funding yet, to try to figure out a way to get to be a part of that program. It's a fee for service in addition to what the patients will pay. But if you, especially within your first grant, I see a first grant question. A lot of times if you can say, we've got this grant, we get safety net funding, it's that third party validation. The state trusts us, the state gives us money, you should too. Or this large organization, whatever is one of the big local companies in your community, this organization supports our vaccines for, on an annual basis. Would you like to support our medical supplies? Or, people like the recognition, businesses like the recognition. A lot of times they don't necessarily want to be the first one to donate or to make a larger gift because they don't necessarily want to hang it all out in case something goes wrong. But they do like to play in the same pool with some of their competitors, especially when you've got a community with a lot of locally owned businesses.